Good morning, everybody. I'm Dean Malvick from the University of Minnesota. I'm a plant pathologist based in St. Paul. So I'll be presenting this information on soybean diseases. And Angie Peltier, who is based in Crookston with the University of Minnesota Extension, also contributed to this presentation. Okay, a key point I think many of us know is that diseases will continue to challenge the goal of attaining high and consistent soybean yields. So the challenge is trying to figure out which of these new diseases we have to worry about, which ones do we have to think about, which ones do we have to manage. So this presentation will highlight a few new diseases and a recurring one that presents some disease management challenges for the region. So those that I'll talk about are the following. Diseases that are moving or moved north. I'll talk a bit about sudden death syndrome, a relatively new disease for the northern part of the state and from North Dakota, brown stem rot, and FROGEYE leaf spot, which is a leaf disease, obviously. And I'll mention a little bit about white mold too, and some new potential ideas for managing that with fungicides. So first of all, we'll talk a bit about sudden death syndrome, a relatively new fungal disease of soybean in the northern part of the state, and can cause significant problems. And the symptoms you see here are classical for sudden death syndrome. And a key thing to keep in mind about this is that at its heart, it's really a root disease. The fungus that causes this infects the roots. As it grows in the roots, it produces a toxin that moves up into the leaves and damages the leaves, creating the kind of symptoms that you see in the bigger photo. So where is this in Minnesota in the region? So let's step back about a few years. In the lower part of the state, where there's that red oval, that's where the first disease for sudden death syndrome was first discovered in about 2002 and reported from there. So since then, it has been spreading. And you can see in the counties highlighted with the yellowish or reddish color, those are all counties where the disease has been confirmed. In Minnesota, you can see Richland County in North Dakota was also confirmed there by colleagues from North Dakota State University. And it also perhaps, there's some evidence that perhaps it could be further north in Minnesota and North Dakota as well, although I think we need a little bit more evidence to be sure about that. The key point here is this is a significant soybean disease that's been spreading north and west across the state and the region. So what are some risk factors for this disease? Number one, obvious the presence of the pathogen in a field history. Once the pathogen is in a field, it doesn't go away readily, and it's probably there for a very long time. One of the issues, though, is it's continuing to show up in fields where it's never been seen before. So this clearly isn't a one-stop point for management, but obviously a key risk factor. Compacted soil, poor drainage adds to it. High soybean cyst nematode. As we have more soybean cyst nematode across the region, and the risk for this disease goes up if the pathogen is present. Susceptible soybean varieties, wet soil 2 to 3 weeks after planting, and ideally some saturated wet soil throughout June and July, and then moist soil throughout the entire season. What are the symptoms that we look for? You can see this soybean trifoliate on the left picture, several different stages of disease development on the same leaflets. On the one on the right, you can see very early symptoms, sort of the chlorotic yellow mottling. And as you can look around kind of counterclockwise around that trifoliate, you can see the yellowing chlorosis developing further, along with some necrosis, some brown death of the tissue. And you look at that picture on the right, that's more fully developed SDS, along with what we often see as the cupping of the leaves. A key thing to always keep in mind is that the symptoms on the leaves of SDS infected plants can look very much like the symptoms on the plants infected with brown stem rot. Well, brown stem rot causes the brown stem discoloration in the pith. SDS doesn't do that. But again, they can be easily confused based on the symptoms. And we'll talk more about that in a moment. How do we manage SDS if we need to? Number one, again, scout for it. Try to determine where the risk is highest. No fields at greatest risk. Resistant varieties are effective, but generally speaking, the farther north we go with our different maturity groups, there's less resistance and lower levels of resistance available than further south. Specific seed treatments are labeled for SDS. 3 in particular, these 2 fungicides, Ilevo, now from BASF, and Celtro from Syngenta. I've been doing research on both of these and field studies, and both of those are effective for managing SDS. And there's a biological seed treatment too that some of you have heard about. It's called Heads Up. We tried this in trials as well. Sometimes it shows a clear effect, but it's certainly not as effective as the 2 fungicides in the trials that I have done. Moving ahead, I mentioned brown stem rot. I won't go into this in great depth either, but this is also a disease common across the region. And since it tends to build up in soils, it's a soil-borne fungal pathogen that causes this. And it builds up over time as there's more and more soybean in a field history. Unless there's a long rotation between soybean crops, the risk essentially grows as we have more soybeans in the region. And again, to split the stems is the key to really identifying brown stem rot. The foliar symptoms you can see in this picture in the upper right often show up, but not always. So again, splitting the stems is the key. And the disease can cause significant yield loss. Up to 30% has been reported and measured. Probably 10 to 20% is more common where the disease is prevalent. And again, to make this point, the disease can be widespread with just the internal stem symptoms without the leaf symptoms. So what are a few key points to keep in mind about brown stem rot? This fungal disease is favored by cool temperatures during flowering and pod development. The leaf symptoms are most severe when there's wet soil at flowering and pod fill and dry soil after that. The disease is also enhanced by soybean cyst nematode. So again, as soybean cyst nematode increases and spreads in the region, the risk of this disease likely goes up too. This is also favored by soil pHs below 6.5. And again, like I said before, symptoms are often not visible on the leaves, and they must be split to diagnose. And even though it's not visible, sometimes it can cause premature defoliation. We can manage this with crop rotation, since the pathogen primarily infects only soybean. And the longer we're away from soybean, the lower the population of the fungus is in the soil. Resistant variety is also very effective for managing this. The other disease I want to mention briefly is FROGEYE leaf spot. Now, this is a foliar disease. It affects the leaves, as the name implies. Now, until recently, it was uncommon in Minnesota and North Dakota. It's definitely been increasing over the past few years. In Minnesota, and this year, there were substantial amounts of it reported by Sam Markel from North Dakota State in North Dakota. So I know in 2019, it reached levels of concern in a few Minnesota fields, enough concern such that fungicides were sprayed. So what are the symptoms? You can see the brown round to oval symptoms here. These round to ovals, tan to brown spots are surrounded by a darker purplish ring. And black specks may develop in those lesions that you may be able to see with a hand lens. And the spots then may grow together and kill large areas of the leaf tissue. So again, yield loss can be considerable, especially in the southern US where this is a significant disease. Favored by warm and humid weather, the pathogen overwinters and infests the soybean residue. We can manage this with crop rotation, tillage, and fungicides. However, management is complicated by the fact that the pathogen, this fungus that causes this, is widely resistant to this QOI that resists the strobilurine class of fungicides. And we found that to be true in Minnesota in some samples that we collected in 2019. Most of the samples that I sent in were resistant to the QOI and the strobilurine fungicides. And this is just a simple map showing some of the samples we got in 2019. We haven't had them analyzed yet from 2020, again indicating widespread, very likely widespread fungicide, strobilurine resistance. So the last disease I want to mention briefly that we've been working on is white mold of soybean. Now, I think nearly everyone is familiar with this disease on one crop or another. It can be a very difficult one to manage and a real problem when the conditions are right to favor it. Now, I'm not going to go over a lot of the basics, but I want to mention a few things that are relatively new. One is that you've probably heard about the soybean gall midge, and there's been a lot of information. There's more opportunities to learn about that as well. There's also another gall midge that's related that actually feeds on the white mold fungus. Well, it's not damaging, as far as we know, soybean directly, but it's associated with the white mold. It's associated with that. Another thing is that low resistance to white mold in some new soybean varieties, especially some of the new herbicide resistant varieties, is a significant issue in some places. So I've seen a number of fields and farms with higher levels of white mold with some of the new herbicide resistant traits. I know of some farms in southern Minnesota that were significant problems this year. Now, that's not necessarily associated with the herbicide, but it may be associated with pushing the variety forward without a normal or adequate level of white mold resistance. Another thing to be aware of, if you haven't heard of it, the University of Wisconsin-Madison, Damon Smith and colleagues there developed a Sporecaster white mold risk assessment app that can be downloaded to a smartphone, and information can be put in there by location to kind of assess what the risk of white mold is. And the last thing I want to mention is Angie Peltier, based up in Crookston, has been working on improved fungicide application methods for white mold. And I'll get to that in a moment, but looking at the bigger picture, how do we manage this disease if we have a recurring problem with it? And know the fields and the white mold risk in each one. Plant the most resistant soybean varieties you can with resistance to white mold, although there are none that are completely resistant. Perhaps reduce the planting density and increase the row width if that's feasible. Consider fungicide applications. They can dramatically reduce white mold and improve yields if they're applied properly at the right time. Other options might be this biological product called contans, modifying irrigation frequency if that's something in the picture in the field, etc. Lastly, I want to mention the work by Angie again. So we know that optimal fungicide efficacy occurs for white mold when the fungicides get down below the canopy. The initial infection of white molds occurs in the lower to mid part of the canopy. So if we spray fungicides only on the top, we have less options, or generally get less coverage in that middle part of the canopy than would be ideal. So Angie's been working on this method to improve fungicide applications. And she shows some test papers here in the lower right, where you can see the deposition of fungicides within the canopy using the over to the top application versus the deposition on the right there in the canopy using an application where the fungicide is actually sprayed down between the rows. And she put together a very nice summary of this and what was found this past year in this report right here that you can see noted. And this can also be found online. These slides, I believe you'll be able to have access to later. So that concludes the presentation. Now I've put most of these slides together. So any mistakes, please ask me. Angie had only the part in terms of the last fungicide application component of this presentation. And if you have questions or comments, please let me know. And thank you for listening.